Hello, everyone, and welcome to the 2021 edition of the Ontario Medical First Responders Competition. On behalf of the Chancellor, Elaine Lawrencell, the Priory of Canada, and on behalf of St. John Ambulance Council for Ontario, it's my pleasure to welcome you as you demonstrate your skills of applied first aid in a uniquely competitive environment. My sincere appreciation is extended to Paul Sims, the chair of the competition committee, and his entire team who've worked so diligently within a constrictive environment to provide you a safe and hopefully enjoyable venue to demonstrate your skills. I am sure that many of you have participated in our COVID response in Ontario, whether at food banks, delivering protective equipment, staffing COVID or vaccination centers. Your efforts are making a difference. You are amongst St. Johners around the world who are carrying on nearly a century of humanitarian service under the 8-pointed White Cross. For all your efforts, we extend our most sincere gratitude. Today, you'll have an opportunity to participate in an ingeniously modified program that will not only allow you to demonstrate your individual skills, you will still feel the rush of the competition as you pit your knowledge against that of your peers. Friendly competition is an excellent way to challenge us all to achieve greater competency in responding to real emergencies. You know, over 30 years ago, I chaired this very competition committee, and I know it's likely before some of you were even born. The competition's come a long way in that time, and you are the next generation of St. John leaders that will keep us relevant for the next 30 years. Once again, my most sincere congratulations to all of you for your dedication to St. John and Ontario, and staying home with a prize or not, you are all winners this day for St. John. Have a great competition.
Hello, and welcome to the competition. Over the past 30 years, I've been a competitor, coach, judge, and organizer, and I'd like to recognize the work of the organizing team. On behalf of the competitors, thank you for your creativity and continued efforts to challenge us and help us learn. Competition is a fantastic way to practice our skills and challenge ourselves to improve. This has been a year where many St. John members have explored new ways to engage with each other and their communities. This has included supporting COVID screening and isolation sites, creating new virtual training opportunities, doing virtual visits, filming YouTube videos, and the list goes on. This competition is yet another example of that ingenuity. If you have new ideas and ways to support each other and your communities, please connect with your branch. Continue to follow the direction of the Public Health Advisory Task Force, who will continue to guide our training and service activities. Enjoy the competition, good luck, and have fun.
Welcome to our pro competitors. So are we excited for the competition? We have had a few opportunities to trial and error this process. So I'm going to share my screen and I'm going to have you guys practice with a practice Kahoot, just so that you know how the competition is going to work. So what I'd like you to do is go to kahoot.it, www.kahoot.it, and then it's going to ask you for a PIN number, 30526, and you'll notice there's a pattern to enter, which changes every 7 seconds. So it's up here on the main screen. And it just keeps people from joining us when they are not in this Zoom meeting, okay? So it's going to keep your competition nice and fair. So Alex is in. Excellent. Matt's in, good. There's only 3 of you in the room right now. So good news, you're going to be in the top 3. But that's what we get for the pro. I know, right? That's what we get for the pro level. And Wesley, are you going to join?
We had 5 registered, but it's good to see the 3.
Yep, exactly. So I'm going to start the practice session just so everybody can see how it works, and Wesley can join us for the actual session. Okay, so we're going to start. And for those of you who don't know how to Kahoot, our practice Kahoot is just going to show the 4 different types of questions you are going to see in your competition. So the first one is a quiz question. What year was the first aid course in Canada held in Quebec City? So it should come up on your screen. and you just simply check your answer. Right here, the purple number countdown is how long you have left. So the answer is 1882, and we'll see who got it right. Matt got it right. Excellent. I know these random questions from St. John history, not everybody knows. The Eye Hospital in Jerusalem, is it there? The Eye Hospital is in Jerusalem, and the answer is true. It is there. So the faster you answer the question, the more points you get, as well as if it is correct. Type the answer. Cardiopulmonary resuscitation is abbreviated as, so you can practice with your keyboard. CPR. Remember that spelling does count, okay? Puzzle, this is putting them in order, so you just have to tap them in order. Put these Knights Hospitallers history in order from oldest to newest facts. So we just have to put them in order by tapping the screen. Some people had mentioned they had to grab and click and move it, depending on what type of device you're using. We don't have anybody answer. Oh, there we go. We've got an answer. That's good. It's a tough one, especially if you didn't get to attend the youth knowledge of the order. So the answer is that the Knights Hospitallers were founded. Blessed Gerard was appointed the first Grand Master, and then they fled to Rhodes for the first time and established new headquarters in Malta. So we then, after all the questions are done, get a podium. So we didn't have a third player right now in the practice, but hopefully Wesley will join us. Second place, as per our little questions, is Matt. And first place, of course, is going to be Alex. Great job. Okay, so now we know how it works. Before we go on to the actual competition, does anybody have any questions, concerns, comments? Death threats? No? Okay, we're good. Oh,
if I win, do I get a pay raise?
You get a 100% pay raise from zero.
Okay, thank you.
Yes.
I was gonna see
that is the goal.
In perpetuity.
Yes.
You get a deal on the next MFR course or the next IDP course.
There you go. I'll tell you what, if you win and you come on my next MFR course, you will get a free prize out of my prize box. But that means you have to drive all the way to Brockville. So
You just tell me when, I'll be there.
okay. Okay, well, without further ado, let's get the competition started. Our pro level pin is 1681898. And again, remember you need to enter the pattern to get in. Hopefully we get the three of you, maybe even we'll have in the Zoom meeting to join, we'll have our 5 total pro registrants come in. So we will just give another second. See if anybody else wants to join.
You having difficulty, Wesley?
Sorry, just give me a minute.
Yep, no problem.
I'm coming for you, Matt.
Friendly competition.
Hey Alex, just for fun, where are you representing? Where you work out of?
So I do some work with the local fire department down in a little town outside of Windsor.
I just recently moved here. I'm up in Renfrew County, and I spent about 5-6 years up in Brandon, Brandon area, and I work with the Winnipeg group. So
Awesome, man. Good to meet you.
That's why you are willing to come to Brockville. You're not that far away.
Yeah.
East representing.
Are you having difficulty, Wesley? How's it?
There we go. Okay,
Excellent.
so we're all in. Let's get this show on the road. So our pro level, first question. Quiz question. An example of an advanced care directive is an advanced care directive. Perfect. Living will or DNR order. Excellent. Quiz question number 2. You are alone and unable to open the airway of an infant who is unresponsive. You must activate EMS when, as per the AMFR, EMR courses. You are alone and unable to open the airway of an infant immediately, of course. Get help on the way.
Well done, guys. You got
Answer.
15 spectators on the stream at the moment.
Excellent. Which heat emergency presents with dry, red, and very hot skin? Spelling counts, remember. Which heat emergency presents with dry, red, and very hot skin? It is heat stroke. And I put stroke there just in case somebody didn't put heat because I had said heat in the question. Wesley, you're on fire. Look at you. You've got your little burning emblem there. Type the answer. The pregnant casualty complains of abdominal pain and nausea. If able, you should position them how? Ooh, this one is a long answer. More than just a couple of letters. The pregnant casualty complains of abdominal pain and nausea. If able, you should position them. Left side or left lateral? Ladies lie left, remember. Excellent. Quiz question. To assess circulation in the lower extremities, you should palpate the blank and blank pulse points. To assess circulation in the lower extremities, you should palpate the blank and blank pulse points. Excellent. Dorsalis pedis and posterior tibial. Look at you go. Wow. Okay, we can still come back from this. True and false. More important than one vital sign is a change in vital signs over time. And it is true. Getting one weird blood pressure at the beginning is not as important as seeing it change. Quiz question. You are managing a casualty with copious amounts of blood and broken teeth blocking her airway. You should? So there's copious amounts of blood. Of course, we need to continue to try and clear the airway until you succeed. We don't want to leave the teeth and everything else that might be stuck in there. Quiz question. During the first phase of an explosion, blank typically causes injury. During the first phase of an explosion, blank typically causes the injuries. It's the pressure wave. All of you are right. Excellent. You guys are just bombing through my questions and you have them. Quiz. Kinetic energy is the total amount of energy. That is where? Kinetic energy is the total amount of energy where? It is contained in an object in motion. Shazam. True or false? Mechanism of injury is the force that caused the casualty's injuries. True. Okay, let's see if I can catch you on a puzzle. Put the following AED sequence in proper order. Put the following AED sequence in proper order. Got one in. The proper order.
I can't drag them.
You just have to click on them potentially on your device. So click on them in the order.
I have to click and hold.
Click
Okay.
and hold. Okay.
Different devices have a slightly different tactile. Yeah.
What? Call 911. Determine there is no breathing or no pulse. Turn on the AED and follow the voice prompts. Haha, I got you. Next question, a true or false. For two rescuer infant CPR, use 2 thumbs encircling the chest. True, that is our landmarking. Okay, quiz question. What are the 2 shockable rhythms for AED? The 2 shockable rhythms for an AED. We're going to press the shock on ventricular fibrillation and pulseless ventricular tachycardia. Excellent. Okay, puzzle time again. Put the following resuscitation in order. Put the following resuscitation in order. Almost there. This guy is needing you to save him. So we're going to start with what? We're going to determine that he is not breathing, but has a pulse of 60 beats per minute. We would begin BVM ventilations at 1 every 5 to 6 seconds, then measure for an OPA, NPA if able, reassess breathing and pulse every 2 minutes. That order is right from your textbook for MFR. I know it might feel a little different. Remember for, sorry?
It doesn't help if you can't drag the answers.
Remember, just click if you need to, click and hold. Next question, what is the depth of compression for CPR on a child or infant? And it's 1/3 the depth of the chest. Those puzzle ones are a pain in the butt, it sounds like. Okay, true or false? For one rescuer child CPR, the ratio of compressions to ventilations is 30:2. One rescuer child CPR, it is true. It only changes when it's 2 rescuer or multi-rescuer CPR. True or false again? For 2 rescuer child or infant CPR, the rate of compressions is 15:2. For 2 rescuer child, of course, again, that's where it changes to 15:2. Quiz question. Patients with some bleeding injuries require oxygen therapy in order to do what? Some patients with some bleeding injuries require oxygen to increase the cellular perfusion. Excellent. Quiz question. Which is a late sign of shock? According to the book, what is a very late sign of shock? Low blood pressure. Excellent. Okay, one of the type the answers. After ventilating Grace for 2 minutes, her color is improving and eyelids are fluttering. What is next? So after 2 minutes, what do we need to do? After ventilating Grace for 2 minutes, her color's improving, and we need to reassess ABCs. Not the full set of vitals, just the ABCs. Quiz question. Tripod position is a person who is sitting blank and fighting to breathe. So tripod position is what? tripod position is bolt upright and leaning forward. So they look like a camera's tripod. They're really struggling to get air in. Type the answer. You arrive at 22-year-old heroin OD. She is unconscious. What type of consent do you have? You have to type it in. Remember, spelling counts. So the unconscious OD, what type of consent is it? She has given you implied consent. Excellent. Moving on to a quiz question again, anatomical terms. The injury to the patient's abdomen was blank to the bottom of the sternum. The injury to the patient's abdomen was blank to the bottom of the sternum. An anatomical term. It was inferior, of course, lower than. You guys are just like, your points are incredible how quick you're doing this. Anatomical term again, the blank thorax includes the chest and abdomen.
Sandra, you may have to make them harder for OMFRC.
I think I'm going to. The blank thorax includes the chest and abdomen. The anterior. The anterior is correct. True or false? Oxygen should never be applied to a hyperventilating patient. It may make them worse. The answer is false. You can do a nasal cannula, and sometimes they're hyperventilating for different reasons. Okay, here's my poll. I just want to know what you think, not for any points. Are we having fun yet? Is this, it's a good time. Okay. Quiz question for you. Anatomy. The largest part of the liver is located in the blank of the abdomen. Liver. Where do we find it? It's the right upper abdomen. Excellent. Quiz question. Anatomy. The spleen is located in the blank of the abdomen. That's a kidney. The spleen is located in the upper left. Okay, so we're going to do a scenario now. The next 5 questions are about Dave riding his motorcycle at 70 kilometers per hour when he lost control and slid into a tree. He didn't have an LOC. He's laying on his back with his knees drawn up, and he's wearing all leather. Quiz question. Your first step to care for Dave should be to do what? Establish manual C-spine. Excellent. So assume every patient has a head and spinal injury. Quiz. His GCS is 15, respiratory rate 26, pulse rate 120, blood pressure 134 on 78. Skin is pale, warm, and slightly moist. These indicate Dave may be experiencing which? Heart rate 120, respiratory rate 26, blood pressure 134 on 78 is compensated or compensatory shock. Excellent. Puzzle. I know your favorite. Part 1. Place the following steps in order of your approach. This is right from the textbook. How are we going to approach Dave? Oh, we've got one right. There we go. Excellent. Next part of the puzzle, continue it on. Place the following in continued order of your approach. So you've already made sure that he is alive. Then what do we do? So perform a rapid body survey. If you find anything, place a dressing on the laceration on Dave's arm, update 911, and then perform a secondary survey. I caught you guys again. This is like the goal of me. True or false? From your assessment, Dave does not have any neck or back pain. You should still maintain C-spine stabilization. True. That was an easy one. Marcia was right. I need to make them harder. Quiz question. Anatomy. The area posterior to the mouth and nose is called the what? The area posterior to the mouth and nose is called the pharynx. Larynx is a little bit lower. Quiz question. To determine the proper size of a nasopharyngeal airway for your casualty, measure it from what? From the St. John textbook. To determine the proper size of a nasopharyngeal airway for your casualty, measure it from what? Tip of the nose to the tip of the earlobe. True or false? The tongue is the most common airway obstruction in the unconscious person. Look at her tongue. True, that is very true. Could you imagine trying to get that tongue out of the way? Quiz question. Which of the following is not a common change due to aging? Which is not a common change due to aging? Toughening of the skin. So for those of you who are IV certified or have ever done an IV, you'll notice that as people age, their skin gets thinner. Okay, next. Puzzle again. You are called to a snake bite incident. List the order of priorities. The snake bite incident, list the order of the priorities. So part of ensuring the scene safety to me is trying to make sure the snake's not around, identify the mechanism of injury, perform a primary assessment, and care for life-threatening problems. Okay, type the answer. When applying a tourniquet to a snake bite, it should be placed from blank to blank centimeters above the bite. When applying a tourniquet to a snake bite, it should be placed blank to blank centimeters above the bite. How many centimeters? Right from the textbook. So of course we only apply tourniquets in St. John if you have been properly trained. And the answer is 5 to 10 centimeters. Excellent. Quiz question. A behavior emergency is when the patient exhibits blank behavior that is blank to the patient, family, or community. They exhibit blank behavior that is blank to the patient, family, or community. It is abnormal and unacceptable. That's right. You guys got that one. That was too easy. Okay, quiz question again. The term reasonable force refers to the amount of force needed to do what? This can be a hot topic debate. In the last MFR instructor course that I taught, this was a debate. The term reasonable force refers to the amount of force needed to It's to keep the patient from injuring anyone, including themselves. Okay, we don't necessarily need to immobilize. We just need to make sure that they haven't got enough movement to hurt themselves or others. Type the answer. The venom sac from a bee stinger can continue to secrete venom for how many minutes? This one's a tough one. Can you remember it from the textbook? The venom sac from a bee stinger can continue to secrete venom for how many minutes? 15 minutes. So we need to make sure that we can try and remove it, preferably with a blank credit card or a blunt object to try and pop it right out. Quiz question. Care for a late or deep local cold injury includes all of the following except what? So this guy's foot has a cold injury. We're going to do all of these things except for one of them for him. What are we not going to do for this nasty looking frostbitten foot? We're not going to rewarm it by soaking it in 40-degree water. That is incredibly painful. Okay, we've got another scenario for you. The next 3 questions are about 12-year-old Paula. Paula was riding her bike through an intersection when she was struck by an SUV at 50 kilometers an hour, thrown 8 meters onto the concrete pavement. Quiz question. Paula is unconscious in the middle of the intersection. What will your first action be? So she's in the middle of the intersection. You just saw this happen. What's the first action? Make sure the area is safe. Of course, we need to make sure we're not also going to get struck by a vehicle flying through these. Completing your initial assessment, her respirations are 6 and snoring, and Paula is bleeding from a laceration to the groin. Next, what do you do? So you've done your ABCs, her respirations are 6 and snoring, and she has a lac to the groin. So we need to open her airway using the jaw thrust maneuver. We need to get that airway open. She's snoring. Although the bleeding is bad, we need to make sure ABCs are our priority. Good job, Alex. You were on fire. Puzzle. Place the following care for Paula in highest to lowest priority. So we're caring for little Paula here, and we need to place them in the highest to lowest priority. We need to maintain her airway with the jaw thrust, ventilate with supplemental oxygen, stop the bleeding by covering all her cuts and bruises, and reassess LOC and her vitals every 5 minutes because she is considered unstable, a little one struck by a vehicle. Quiz question. When the casualty exhales, the flail segment protrudes while the rest of the chest wall contracts. This is what? So in a flail segment, it is paradoxical movement. Excellent. 30,000 points. That's insane. Okay, true or false? Elevated blood pressure is not a sign of a chest injury. Elevated blood pressure is not a sign, and it is true. The next 4 questions all require a compression to breath ratio. Typed responses for 2 rescuer CPR in the following format. So put the number, colon, number, okay? So what is your 2 rescuer CPR ratio for a 10-year-old little boy? 2 rescuer CPR on the 10-year-old little boy. Number, colon, number. 15 to 2. So remember, number, colon, number. Type the answer. A 55-year-old woman. 2 rescuer CPR on this 55-year-old woman. Number, colon, number. It is 30 to 2. Adults, 2 rescuer and 1 rescuer are both 30 to 2. Excellent. Here we go. Another one. A 5-week-old baby girl, 2 rescuer. Number, colon, number. The 5-week-old baby girl, 2 rescuer is 15 to 2. Excellent. And then one more, a 4-year-old large child. This little 4-year-old, what are we going to do? 2 rescuer CPR. Again, it's 15 to 2. Excellent. Okay, We've gotten through those. A quiz question again. The word inline in the term neutral inline position means the patient's what? Neutral inline position. Inline means what? So we need to make sure they're in neutral inline position for spinal injuries, for a C-collar to go on, and it means nose in line with the navel. Excellent. Right from the textbook. Here we go with the true and false. Manual stabilization must be maintained even when the patient is fully immobilized on a backboard. It is false. As soon as they're fully immobilized, we can let go of the manual stabilization. We've got some movement again. Type the answer. Last one, there are usually blank number of bones in the human body.
I think I even remember this one.
I know, this is from many years ago. We used to teach it. There are how many bones in the human body? Remembering we've got, you're sitting there counting all of your bones at home. We've got 3 in each ear. Hint, hint, it's more than 6. You've got more than 6 bones.
Was I right? 206, 206, 206.
Hint, hint, it's 206
Hey, I got it right.
bones in the body. I'm good at giving hints. So third place, Matt, excellent, 30 out of 54 questions. Second place is Alex. And first place, of course, we've got Wesley. So excellent job. Yay.
Good work, guys.
Good job. Did you guys have fun?
Yeah, hopefully you guys had fun with it.
Yeah, it was pretty. I was got the heart pumping a little bit. Some of those questions I haven't heard in like 3 or 4 years, and you type in the answer and you're like, nope, that was totally wrong. That's the right one. Yeah.
And then there was a few for me. It's like, oh no, lower left. Oh no, it's lower left. And then it's like, oh, I got it right, lower upper. Yes.
So after today, like probably later today, Dawn's going to send out an email to each of you with a survey on what you thought of different aspects. We'd really appreciate it if you fill it in. It is anonymous, and it's going to help us decide how to create the May event, which very likely will be in Kahoot, but I need to know how to change it up to make it more enjoyable. Okay.
Sandra,
So
what a host. What a host. You've been really good.
Thanks.
What's up, Sandra?
I'll let Dawn take over. We've got a couple more little videos to show you before we're done.
Yeah, so stand by, guys.
I hope you've enjoyed the 2021 virtual OMFRC. Thank you and congratulations to all of the competitors, and thank you to Paul and his team, the competition committee, for putting this day together. This past year has been one of many challenges and some innovative changes for the organization. Early in the pandemic, we struck the Public Health Advisory Task Force, which has been guiding us since the beginning. Our therapy dog program adapted to window and then virtual visits. Our AMFR volunteers have been participating at COVID assessment centers, shelters, and other community operations across the province. Most of our other programs have adapted to some form of virtual engagement. We successfully hosted our first virtual conference in AGM, and our next conference is coming up soon in April. We also know that this pandemic has posed some challenges, and I'm pleased to say that we've updated and reintroduced our critical incident stress awareness program, and we have some other member wellness initiatives underway. Like most of you, I really look forward to the day that we're able to come together for events like this, our AGM and investiture, our conference, and even our regular meeting nights and training. In the meantime, stay safe, wash your hands, wear a mask, and keep looking out for each other. We'll get through this soon. Finally, once again, on behalf of the Standards Committee, I'd like to congratulate all the participants and thank Paul and his team for putting this day together.
My name is Paul Sims. I'm the chair of the competition committee for Ontario. I am so pleased with the number of participants this year in this zone. The entire competition committee hopes you enjoyed the format, and I would like to thank each and every one of them. Don Smith, Sandra Ladd, Robin Innes, Anthony Chu, Lynn Tejo, Marcia Sens, Russell Walters, Nancy Hutchinson, Harvey Fields, and of course our admin staff, Claire Akinoid and Chris Schmidt. The Ontario Medical First Responders Competition, which is scheduled for this May 2021, is going to be virtual again as well, thanks to COVID. We are hoping for a better situation in 2022. Keep logged on to omfrc.ca for further details. Thanking you once again for participating in our very first virtual competition. Remember to be safe, wear a mask, maintain social distancing, and of course, wash your hands. Thank you.
Okay, guys, that was your competition.
Thank you for joining us, guys.
Thank you.
I'll be sending out the email with the Google form link for your constructive feedback on how we can organize ourselves and better it. Hopefully we engage. Thank you very much.
Thanks so much, guys.
Okay, guys.
Well done. Sandra, you're on mute.
Just need to stop the live stream.
I'm just stopping it now. Hold on.